The communication booths within the clinical skills lab aren't just used for mental health nursing students. All fields of nursing students use the booths, as well as other healthcare disciplines, because communication is such a massive part of nursing. It's not something which is specific to one particular field. The room is quite simply set up. There's some chairs, a television screen, and a video camera in the corner. Come into the room having been given usually a scenario, and you then run through the scenario with your colleagues. So, for example, in the first year, we did some communication skills around motivational interviewing and doing assessments and trying to encourage behaviour change within the patient using the theoretical knowledge that had been taught in lectures, linking health promotion, behaviour change, and communication skills. You run through the scenario, the door's closed, there's no lecturers watching you or anything like that. It's quite good fun. You take it seriously, but have fun as well while doing it, because you're aware that you're being filmed. And then afterwards you go into either the briefing room, or you watch back the filming with a member of the academic staff to have a look at what you've done. It's really useful because I'm sure everyone said at their interviews that they've got really good communication skills, and I'm sure that's the case. But when you watch yourself back, you'll notice that maybe you do things with your hands, or you do things with your hair, or you fold your arms, cross your legs. Whatever it is that you do might be a verbal tick, non-verbal tick, that you just aren't aware that you do. But when you see yourself doing it, you can then think, well, if I was doing that when I'm with a patient, what message is that going to say to the patient? If I'm always sat with my arms folded and my legs crossed, asking someone how they're feeling, it gives the impression I don't care how they're feeling. But you might only see that when you see it back on film. And that's for mental health, adult or child nurses, because we all communicate with patients, families, other professionals. And that's what they're used for, is improving those communication skills, which are already going to be at a high level, but just honing them and improving them to tailor them to what's needed from a nurse, rather than just a prospective student or a student doing a degree at university, making them more clinical so that you can elicit the information that you need from your patient during an assessment.